Hi, I am Nicole at Grace Yoga, and I want to share with you some things that I have found for my clients and for myself that work really well for hip pain, low back pain, um, even into the leg. So, this whole area, some people will call this their back, some people will call this their hip, and some people don't even know what to call it. They just say, it hurts right here. So, two tools that are really good for this are two tennis balls and a sock, nothing too incredibly high tech about it, and a soft foam roller or a hard foam roller. Um, I'm going to show you how to work the whole hip, and we're going to start out with the foam roller. So, you start by sitting and your knees are bent, and you're going to angle your knees towards the hip that you're working on. So your feet are just off center a little bit. And we're going to start by rolling this whole glute. So your glute goes way down to the sit bone and way up here to the top of the pelvis. And we want to do about 5 passes there. So you can see I'm using my hands, I'm using my feet, and I'm really keeping my knees turned towards the hip I'm working on, and we're doing about 5 passes there. After you've done about 5 passes there, you're going to drop down to an elbow. The knees are still turned to the same side that you were working on, and you're going to do 5 passes there. All the way to the bottom, all the way to the top of the pelvis. After you've done 5 passes there, you're going to turn even more onto the side, and we're looking to get into that hip crease, so where your leg meets the pelvis. So I'm taking my top leg on front, I'm straightening my bottom leg out, and where we were rolling that big glute, we're rolling just the hip socket here. So these are smaller rolls, and we're still doing about 5 passes here. All right, now you can keep going, and we're going to turn about 45 degrees towards the floor. So my top hip is here, my bottom hip is down there. It doesn't matter where you are on the foam roller, but you're still doing about 5 passes here. So this is the front of the hip socket, and I'm using both legs to push and pull. Now, that's a good way to get in there, just to do some overall maintenance. However, if there's a real deep ache in there, or you can feel there's something in there and you can't quite get to it with your foam roller, another good tool, as I already mentioned, is this 2 tennis balls and a sock. And I'm going to show you from the side. I'm going to put that tennis ball horizontal, so not this way, but across, okay? So the way that looks is you're going to, again, put that ball, I'm going to put the tail to the back. The tail doesn't have anything to do with anything for this technique, at least, but you're putting the tail to the back, and you've got the ball right there in the hip socket. You can start out, and it's most gentle to do this with your knees bent. And I like to just lay there. For some people that are in a lot of pain, this might be a lot. And so you just want to be there. However, if it's not too terrible, you might find that you can, again, I'm just putting my top leg out so it can stabilize, but I'm going to move it back here so you can see. You might be able to just straighten that leg out, but I like to have my top leg in front. And then the next thing that you're doing, let me get better into the camera so you can see what I'm doing with my leg. So again, your progression is you start with the knees bent, then you're going to straighten your leg, and do you see what I'm doing with that back heel? I'm going to rotate the leg just like this, with my toes digging into the floor. So that's the next progression. And then the next one, which is even harder,
And if you were in pain, you wouldn't want to go to this next one. You'd want to just work with the one you're already gonna get the biggest sensation without throwing yourself over the edge into terrible pain. But the next one is to put your knee down, and I move my back legs or my top legs so you can see this, but you move the leg bent. So now I'm putting my top leg back in front, but that's the action I'm doing with that back leg or the bottom leg. It's bent and it's going up and down, and that's causing quite a bit of massage in that hip. All right, so you can be, now, let me just tell you, again, on the hip, there's some spots here, there could be some here, there could be some in front. You can be anywhere in this area. And so what that looks like in practice, again, is that either your hips are facing forward or your hips are facing down a little more or down even a little more. And all that stuff I showed you with the back leg, you can still be doing that in any of these positions, or I call this arm wrestling myself. So that's how you get around the hip, either with the foam roller, handy dandy foam roller, or your tennis balls in a sock. There are lots of other tools out there in the world. There's tools that are already made like this called a peanut. Some companies sell them, or some people I've seen take lacrosse balls and tape them together. I think that those are too hard, and I think that they can do damage and cause you to be more sore. And what we're trying to do is get that area to soften, not harden. And when you use something really hard in there, your tissues just go and they get hurt, they get bruised, they get hurt. So I advise nothing harder than a tennis ball. A tennis ball is plenty hard, and many of you know that I do Yamana body rolling. The Yamana balls are really soft, and they cause deep and profound change to happen too. So the tennis balls are the hardest thing I use. You can use a soft foam roller or a hard foam roller, but the bumpy foam rollers are not the best use for this hip pain. And that's going to help your low back, it's going to help your hips, and it's even, going to release down into your thighs. Hope that works for you. You could do the same on both sides, and you should, okay? And compare your two sides. See if the sore side is really the problem. Sometimes the sore side is the symptom, and the other side, which is not necessarily hurting you, is the one where the pain is coming from. And so you would do that same thing. You would foam roll the glute. So you're, again, foam rolling that large glute all the way around to the front of the hip, and then you could get in there and detail some more spot-specific areas in your hip socket itself with the tennis balls. All right. Please email me or call me if you have questions. My studio is Grace Yoga in Loveland, Colorado, and I look forward to hearing from you anytime. Have a great day.